Hello everyone, how are you? Today we are going to discuss another question for MRCS exam. A 43 years old man is reviewed in the clinic following cardiac operation. A chest X-ray is performed and a circular radio-opaque structure is noted medial aspect of fourth intercostal space on the left. Which of the following procedure is the patient most likely to have undergone? So here a 43 years old man review in the clinic following the cardiac operation, that means the operation done before, and uh, he now present for regular checkup. A chest X-ray is performed and a circular radio-opaque structure. So this point is important. A radio-opaque structure, that means a metallic structure present in his chest, and it lies medial aspect of the fourth intercostal space, and this radio-opaque structure lies in the fourth intercostal space, which is following procedure in the patient most likely to have. That means what operation was done for the patient. So we have to find out first that in the fourth intercostal space which structure usually lies and which is replaceable for any operation. So here the options. The options are aortic valve replacement with metallic valve, tricuspid valve replacement with metallic valve, tricuspid valve replacement with porcine valve, pulmonary valve replacement with porcine valve, and mitral valve replacement with porcine with metallic valve. So it is a radio-opaque structure. So the porcine valve, it will not be answered because it will not give any radio-opaque shadow. So the radio-opaque structure lies medial to the fourth intercostal space. So we have to find out here all of the valves. So we have to find out the normal anatomical location of the valve which lies in the fourth intercostal space of the left side. So here the location of the heart valve, aortic valve usually located medial to the third intercostal space right, and mitral usually located medial to the fourth intercostal on the left, tricuspid usually located medial to the fifth intercostal on the right. So here aortic valve, so we can see the aortic valve lies in the third intercostal space, mitral valve lies in the fourth intercostal space, and tricuspid valve lies in the fifth intercostal space. And here important note that the artificial valve or the normal valve location and auscultation site are different. So the valve location is a place and the auscultatory area in the another place. So we have to remember for wall valve what is this anatomical location and what are the auscultatory location. So in this picture we can see here the location of the valve, and you can see this is the location of the valve they are showing. This is pulmonary valve, and then aortic valve, and then mitral valve which is there, and tricuspid valve. So the valve, all the valve are located, it is close to the sternum, and it is the medial aspect of intercostal space and very close to the sternum. So here in this picture we can see the location of the valve. Here the pulmonary valve, it lies here, then aortic valve here, and pulmonary valve it lies this place, this toe, but it gives auscultatory sound here. There lies in the third intercostal space, but the auscultatory area is the second intercostal space. On the other hand, aortic valve it lies like there, that means in the third intercostal space, and it provides its auscultatory sound at the level of the second intercostal space on the right side. And here we can see the bicuspid valve, which lies in the fourth intercostal space in the left side, but it provides its sound in the apex of the heart that lies in the fifth intercostal space. And also we can see this is the tricuspid valve, and tricuspid valve lies in the right side, but it also provides it is oscillatory sound on the left side. So this location we have to remember very carefully. This is the anatomical location. Aortic valve, it lies in the third intercostal space on the right. Mitral valve, it lies fourth intercostal space to the left. Tricuspid valve is located the fifth intercostal space. So these spaces are very important to remember, because the anatomical location of the heart and the oscillatory location of the valve of the heart, they are different. The aortic valve, it lies in the third intercostal space, but its oscillatory sound found in the second intercostal space on the right. On the other hand, in mitral valve, it usually located in the fourth intercostal space on the left side, on the medial part of the intercostal space, but it provides sound or oscillatory sound in the fifth intercostal space, and it is the mid-clavicular line. And on the other hand, the tricuspid valve, it usually located in the fifth intercostal space in the right, but it provides its sound to the left side of the heart. So this anatomical location is very important, and the oscillatory sound is also very important, and we have to be very careful during reading the question that this location, is it anatomical location or is it the oscillatory location. So very carefully we have to recite, or we have to read the question. So here we can see the anatomical location of the valve. They usually located very close to the sternum in this picture. So our final answer is mitral valve replacement with metallic valve, because the anatomical location of the mitral valve is in the left fourth intercostal space, and it is radio opaque. As it is radio opaque, so it is metallic valve. So our final answer is mitral valve replacement was done of the patient with metallic valve. And other options we can see the aortic valve replacement. Aortic valve lies in the we normal know it is the third intercostal space. Tricuspid valve, it lies in the fourth intercostal space, tricuspid fourth. And pulmonary valve replacement, usually it lies in the third intercostal space. And in case of porcine valve, it is not true, because porcine valve will not be radio opaque. It usually don't give any shadow. So our final answer will we have to confine to the metallic, and as it is the fourth intercostal space, so mitral valve anatomical location lies in the fourth intercostal space left. So the answer is mitral valve replacement with metallic valve. Thank you.